Hello family, welcome back to my channel. If you are new here, you're most welcome. If you've subscribed and you're not new, thank you for the continued support. And please, if you have not subscribed, please remember to subscribe and hit the notification button. Give us a thumbs up, comment down below and how to think about our topics, share, and please watch it. Okay, welcome. Today I'm doing a topic to do with health. It's entitled infertility. At some point we all have come across the term infertility, and in the layman's language, it's a condition or it's a state where a couple are not in a position to give birth to their own child. It could be because of health issues or other issues. So I'll be getting deeper into the topic, and I'll be doing I'm doing this topic in 2 bits because it's quite wide. So today I'll be handling half of it, then next time I'll handle the other bit. So I'll be doing what is infertility, the types of infertility, and how infertility is diagnosed. Okay, and to my first point, what is infertility? Infertility is a condition where you cannot get pregnant after 1 year of trying to conceive. As a couple, after 1 year of trying to conceive without using birth control methods, if you're not in a position to conceive, you can render yourself or as infertile, and it is advisable to seek medical assistance. In women, there are causes of infertility in women as well as in men. So in women, infertility can be caused by endometriosis. This is a condition where you bleed, which is very painful. Endometriosis are tissues that grow outside the uterine wall. They are similar tissues to the endometrium. They grow outside the uterus and they come out as menstruation, and they are very painful. As a woman or as a girl, you bleed too much and they are very, very painful. It could also be uterine fibroids. Uterine fibroids are growths that grow in women, and they are non-cancerous, or because of thyroid disease. In men, on the other hand, fertility problems may be because of a man has a low sperm count, or they have low testosterone. Testosterone are the glands that produce the sperms. The risk of infertility increases with age. No wonder, like for a woman who is 35 and above, conceiving is not very easy. It's harder as compared to a woman who is below 35. So healthcare providers consider a couple infertile if they try but fail to get pregnant within 1 year without using birth control methods. Okay, when a woman is older than 35 of age, so 35 and above up to around 40, the amount of time trying to conceive drops to 6 months. So if you are 35 and above, after 6 months of trying to conceive without conceiving, it could be because of infertility issues. For women who are 40 and above, if an immediate evaluation is warranted. Like if you are 40 and you're not conceiving, you could be infertile, but in this case it is not always the same for everybody. There are special cases. Okay, infertility does not include miscarrying or being unable to carry the child up to the point where you give birth. Miscarriage is where you lose the child before they are 20 weeks old. On the other hand, there's the stillbirth. Stillbirth is when you lose the baby after 20 weeks of pregnancy. Okay, according to research, 1 to 3 infertile women have issues to do with the female reproductive system. The same way, 1 to 3 men who are infertile have an issue with the male reproductive system. So meaning, if is a man who is infertile or is a woman who is infertile, you can seek medical help any sort and be able to conceive. Yeah, as a couple. 1 to 3 couples have a problem that affects both of them and or an undetermined issue, as in a common issue. Then 1 to 10 women between 15 to 44 years have trouble conceiving. So you should not be there saying, oh, I have an issue with our family, what. No, don't be afraid. It's an issue that is there, and you shouldn't kill yourself because of not being in a position to conceive. Okay. Now the types of infertility. I'll do 2. There's a primary infertility and the secondary infertility. Primary infertility is whereby a woman who has never been pregnant, who can't conceive after 1 year of not using birth control. Primary infertility is a woman who has never conceived and you have tried to conceive for 1 year without using the birth control methods. For the secondary infertility occurs when a woman can't get pregnant again after having at least 1 successful pregnant. So give birth to your first child and that's it. That's secondary infertility. Okay. Infertility can be caused by many factors. It could be age for women aged 35 and men who are aged over 40. At some point, or most of the times, they could be infertile. Diabetes, then ugonjwa sukari, is also a cause of infertility. Eating disorders, excessive alcohol use, exposure to environmental toxics such as lead, pesticides, maybe where you work or where you live, yeah. Over exercising. It's okay to exercise, but don't overdo it. Then radiation therapy or other cancer treatments. Okay, we are aware of radiotherapy is one of the methods that is used to treat cancer and can be a cause of infertility. There's also the sexually transmitted diseases. Couples are advised to get treatments of such diseases. There's also smoking. There's stress, substance use, weight problems. You could be obese or you could be underweight. It can be a cause of infertility. So I'll be doing how is infertility diagnosed in both men and women. I'll be starting with women. There are many methods that can be used to diagnose infertility. I'll be doing some of them. For women, basal body temperature and cervical mucus. Your healthcare provider can help you determine the body temperatures that are right for getting pregnant or for conceiving in the base in the cervical mucus level. There is also a home ovulation kit. This is simply the pregnancy test kit. you can test as a couple whether you are pregnant after trying to conceive. Yeah, and if you're not conceiving, you can at times identify that maybe you could be infertile or there could be an issue. There's also the blood test. It checks the hormonal levels, the thyroid hormones. Basically the check of the hormone levels. See, the hormonal levels that are important for someone to conceive. Yeah, the blood test can be used. There's also the transvaginal ultrasound for doctors. In this one, a doctor inserts an ultrasound wand into the vagina to look for problems within the reproductive system. This is simply the ultrasound. It's the same one that is used to determine the gender of the child. The ultrasound that is common to most of the people. Then there is the hysteroscopy. Your provider inserts a thin lighted tube hysteroscope into the vagina to examine the uterus. Yeah. And to the other point, how is the male infertility diagnosed? One is a semen analysis. The test checks for problems with the sperm, such as low sperm count and poor mobility. Yeah. The semen analysis, it checks the sperm count or maybe even the mobility. They could be moving very slowly. Maybe the tubes could be blocked. Yeah. Then there's the blood test. A blood test can check the testosterone, the thyroid and other hormones levels. Yeah, it's the same for men. There are hormonal levels that are important or that are required for someone to conceive. There's also the scrotal ultrasound. This is the ultrasound for men. An ultrasound of the scrotum identifies the varicose or other testicle problems. Okay. When should you seek help for infertility? Women under the age of 35 who aren't pregnant after 1 year of trying to conceive should see a healthcare provider. If you have older than 35, seek help after 6 months of trying to conceive. Yeah, that's a repetition. If you are below 35 after 1 year of trying to conceive and you're not in a position to conceive, you can seek healthcare help. For women aged 35 and above, seek help after 6 months of trying to conceive. A woman's chance of getting pregnancy decreases with age. Yes, according to science, women become menopause at the age of 45 where they can't conceive. A 30-year-old woman is half fertile as a 20-year-old. So a 20-year-old is more fertile than a 30-year-old. Regardless of your gender, you should seek help early if you have a risk factor that affects fertility. Yeah, you should seek help. It should not be always the case that this one must be the woman. No, it is not always the woman. As a couple, it could be either of you. Don't do blame games in this one. Yeah, the medication for fertility for women and for men, it's the same. You could do how to treat infertility rather for both women and men. It is either medication or through surgery. Medication is whereby fertility drugs which change hormonal levels. A surgery can open blocked fallopian tubes and remove uterine fibroids and polyps. Yeah, that's for women. For men, medication, the other, it can raise testosterone and other hormones levels For surgery, some men need surgery to open blockages in the tubes that store and carry the sperms. Okay, this issue of infertility, it poses many challenges. Yeah, we have broken marriages, you have men marrying second wives, you have men putting all the blame on women, we have couples who have parted ways. Yeah, we have women who have been rejected because of infertility. Yes, and it is okay to seek help, both of you, before making any judgments. It's okay to seek help. Yeah, it can affect your relationship and even emotional health. Yeah, for a woman seeing other women carrying kids, it affects them emotionally. That's why you find cases where some women kill themselves, some women go to hospital to steal or to escape with babies. Infertility treatments can also be costly and can cause a strain in your finances. Yeah, treating the issues of infertility is very expensive. It's not cheap, and some couples opt moving out or even marrying second wives. Yeah, your healthcare provider can determine the cause of infertility. The first steps helps determine the best treatment to help you succeed in expanding your family. Most of the couple eventually get pregnant. Yeah, if you seek help, you are sought out with the best method to help you get kids and expand your family. If you don't, at time it is beyond help. It could be because of family history. Yeah, it could also be because of some of the things you did. It could be because of abortion, taking pills. Yeah, those are some of the issues, and some of these issues you can't reverse them. If you're in that position, that's not the end of it. You can seek help like adoption. Yeah, you can choose to adopt a child. You can do a surrogate where you agree to get another woman to give you kids. Yeah, I'll be handling the remedies for infertility for couples, and they still remain relevant in expanding your families in my next topic. Thank you for watching. See you next time.